Because without testing, you only have one dial. You only have the hospitalization dial. And the hospitalization dial is a little misleading. Well, it's not misleading. It tells you what it tells you. But it tells you people who got infected in some period over the past 2 weeks or maybe 3 weeks, and who are seriously infected so that they had to go to a hospital. But that's all that hospitalization rate gives you. The antibody test and the diagnostic test give you a higher level of information by region. Go ahead, John, before you jump out of your chair.
The Westchester County Center was one of the areas that was or one of the facilities that was crafted into a temporary hospital. The infection rate's going down. The work has been completed there, but there have been no patients as far as I know. What do you do now with those facilities, with that facility in particular, that there doesn't appear to be much of a use for it?
Yes. Today, we are in good shape, and today, that would be a true statement. Do you know if that'll be a true statement in 60 days? I do. So what would you do with the facility?
I'm not the governor.
Yeah, but what would you do if you were the governor? You'd leave it right there, because you don't know what it's going to be in 60 days.
I mean, is there a possibility that you could transfer? There's been lots of talks about nursing home patients and residents. Could you move people out of nursing homes into a facility
Nursing
like
home
that?
patients, let's go back to square one. A nursing home can only provide care for a patient who they believe they can provide adequate care for. If they cannot provide adequate care for a patient, they must transfer that patient. If they can't find an alternative nursing home or facility, Department of Health will find an alternative nursing home or facility. We have vacancies in nursing homes and in facilities. There is no nursing home who says, I have John, I can't take care of John, I don't know where to send him. Then call Department of Health and we'll find a bed for John in a facility that can take care of him. That is how it works. There was one story that said, well, nursing home said they wanted to send someone to the Comfort, which was the ship the federal government gave us. And Department of Health said they can't send them to the Comfort. Yes, a nursing home can't send a person to the Comfort because that's not the agreement with the federal government. Comfort only took referrals from hospitals, so the person was assessed at a hospital first. But forget the Comfort. If a nursing home calls up and says, I can't take care of this person, we will find a bed for that person, period.
But doesn't that, isn't that
Facility, if they're going to care for you, must quarantine, must have PPE for staff, must follow these guidelines. Or they say, I can't take care of John. I can't take care of him. I'm not equipped. I don't have the space to quarantine. I don't have the staff. I don't have the PPE. I can't take care of John. I'm going to transfer John to another facility. Or I'm going to call the Department of Health and tell them to come pick up John. But if you keep John, and I'm paying you to keep John, or John's family is paying you to keep John, then you have to give John the appropriate care. And here's appropriate care for a person who's COVID. Sir.
Alec Baldwin has released a video calling on you to grant broad clemencies to people in the prison system here. Do you have any plans to do that, and what do you make of his comments?
We have been doing that.